talk about flow dilation. How can we be able to be sure, Doc, if our blood vessels are really dilating or opening up? FMD. It is now the biomarker for human cardiovascular health. Look at this, people, and listen to this one. Okay? Introducing the most advanced, non-invasive angiogram alternative. It is not a replacement, it's only an alternative. Okay? Categorized as Class 2 medical equipment by USFDA. So people, what is the name of our product? Angiogram. It's a device, people. It's a device. Okay? Before we discuss it further, the 10 leading causes of morbidity, of course, when you talk about morbidity diseases, that is the heart. But when you talk about death, number 1 and number 2 will be your cardiovascular. Let's talk about facts here in the Philippines. 3 in every 10 Filipinos will suffer from heart disease. Approximately, we're more than 100. But let's just try to imagine that we are 100 inside this room. So 3 out of 10, which means 30 out of 100, will suffer from heart disease later on. And look at this, 70% of heart disease patients, that is the 70% of the 30, will not survive. So if I'm going to look at your faces, approximately 20 of you will not survive. So again, can you please look at the one beside you? Ikaw yun. So people, would you like to be healthy, yes or no? Yes. So guys, now, ito na po. What's once again? Hardening and thickening of the blood vessel wall. Okay? Plaque buildups inside your arterial wall. But the problem is, once it ruptures, guys, it will further what? Block the blood flow. And again, that will lead to heart attack or even stroke. Let's continue, guys. This is what we fear most. For you to suffer from cardiopulmonary arrest. And again, I would like to remind you, it is said to be asymptomatic. That once you start feeling that old chest pain, it may be too late because in a matter of few minutes, you may die. People, there are said to be non-invasive procedures that you can do. X-ray, 2D echo, ECG, CT scan, and of course MRI. I guess it's approximately around 10,000 pesos. Okay? Or more. At least it's 10,000. Okay? What else? Invasive. This one is not expensive. The cheapest will be 50,000. As high as 100 to 150,000. What will they do, people? Of course, they will try to insert a catheter in one of your major blood vessels, and it will end up in your coronary artery. To be able to look if the coronary arteries are still functioning well. Okay? Now, what should they do? What should we do? First, know your potential risk of heart attack or stroke. Does it run in your family? Do you have histories of relatives or friends who suffer from stroke or heart attack? Or should I say relatives who suffer from stroke or heart attack? Second, know the amount of plaque buildup or blockage in arteries. How can you find it out, people? ECG, 2D echo, know the condition of your blood circulation, know the level of your physical and mental stress. And these are the things that you would like to find out if you're really healthy or not. Now, again, category is Class 2, equivalent to USFDA, and made in South Korea. Guys, again, what's the name of this product? Cardiopulse. Fast, safe, convenient, accurate diagnosis, non-invasive, people is worth affordable. Who amongst you have undergone Cardiopulse test? Can you say raise your hands po? Let's give them a round of applause. Okay. And for undergoing Cardiopulse. So there's still many of you who haven't tried this procedure before. I would like to clarify, guys, it's an angiogram alternative. If you don't have the money yet to undergo angiogram, please do this initial step. Or, it's a good step for you to find out if your blood vessels are functioning that well. Okay? Guys, it is through electrical wavelengths. Can you please say the words? Electrical wavelengths. Now, people, what's the procedure? How does it go? You will please avoid, or should I say NPO, don't eat for 3 hours before the actual procedure. Don't drink stimulants like coffee, tea, chocolates, 3 hours prior to the test. Once you go inside that clinic, our cardio pulse clinic, okay, that can be seen in all the branches and centers of the global, nationwide and worldwide, okay? We have to ask you to rest for approximately 30 minutes to 1 hour. Then, remove all the gadgets, okay, rings, watch, necklace, okay, everything, even coins. And if I ask the guys to remove your belts, okay? Only your belts. That I would like to clarify, okay? So after which you will sit comfortable in a chair, okay? Use the back chair, guys. Then place your left hand on an armchair or table at the level of the heart. And after which, place the cardio pulse as big as a stapler on your left index finger. Be sure that you'll be able to feel that so-called small opening under. No manicure, nail polish should be removed. Okay? Now, the test will only run for approximately 3 minutes. And what should be the steps that you should undergo during the actual test? These are the so-called requirements. First, you're not supposed to talk. You're not supposed to cough. Prevent from smiling or even laughing. And please, do not close your eyes for more than 10 seconds. Especially now. Now, after 3 minutes, people, after just 3 minutes, we will give you the actual result, okay? And that will be just the things that you will be able to see on that so-called paper. So, sympathetic and parasympathetic nervous system, you should be at the center for it to be functioning well. Second will be your physical and mental stress. Again, are all of us suffering from stress, yes or no? Yes. Heart rate approximately from 60 to 80, maximum 100. Also the first ectopic beats or irregular beats of the heart. And guys, let's talk about this one. Okay? The cardio score. Again, can you please say it loud? Cardio score. We have 7 types for this. We have 7 types. What are these types? Okay? Members of the company, you must be able to interpret this. If your scores will happen to be ranging from 1 or 2, I congratulate you, you passed. If that will be 3 or 4, that's already a warning for you. But if that will turn out to be 5, that's already bad. 6 will be very bad. And 7, you will be categorized as high risk. Tagalogin natin, may paglalagyan ka na. Kidding aside, you're trying to make you laugh, that will be a possibility. That anytime people, you may suffer from cardiopulmonary arrest. Why? That is a normal lumen of a good heart people. And if and ever you will suffer from atherosclerotic plaques, that will happen to you. And again, if there will be presence of clots here, that will mean what? Heart attack or stroke. People, a good cardio score will indicate a good vascular and heart health. Guys, if you happen to be a member in Global, if you will register now, automatic people, we will give you 3 certificates of cardio pulse with 50% discount. You're done with guys? Yeah. So, guys, what are we supposed to do? Okay? What are we supposed to do? If you're already a member, okay? If you're already a member, automatic, you will receive 70% discount for cardio pulse. So if you have the certificates, might as well give it to your loved ones, to your friends, or even neighbors. But please, before you give it, kindly write your names here and your ID number. And kindly assist them. Look at the client. No more neck. No? Lucky! He's so fat, no? And of course, you have to be happy. Why? Because you will be able to help your client when it comes to this help. Now, when you try to accompany them in their cardio pulse clinic, okay, of course, the staff there will do the procedure and later on it will be interpreted. But for the old members or the old timers of Global, okay, once again you undergo cardio pulse test, how many percent will you get, guys? 70%. But automatic people, once you pay it, you will also receive 2 gift certificates with 50% discount of cardio pulse. Will that be good, people? Okay, let's continue, guys. How to maximize? How to maximize? Okay? Have the nurses inside that clinic explain the results. People, again, in that piece of paper, the results will be shown. The stress level will also be shown there. It will be explained. And what's good is at the back of that page, we will be having these so-called recommendations. Whatever the type of your cardio score will appear there, guys, there will be a corresponding number, okay, of products that your client must take. So even if you happen to be a new member and still can explain the products, don't worry why. Because the company will help you explain the products to your clients. So the question is, will that be good, people? Yes or no? Yes. And so if your score will only be 1, so most probably you will only take 1 capsule of C10%, 1 capsule of Condensimigan, 1 capsule of Vida. Guys, let's talk about this, okay? Please, once you ask your client to undergo the cardio pulse, once you sell the products to your client, it doesn't end there. It will only start there. Why? Because you need to ensure people that after 1 month, if their scores are really bad, they have to come back for another cardio pulse test. Every month, please follow up on your clients. Convince them never to stop undergoing the cardio pulse. Now, people, look at this. If ever, okay, the scores will improve. If ever, the health will improve. I can assure you, that will be a good testimony on your part. Why? It only proves how beautiful the products of Game Global are. Will I stop from using the products? No, definitely not. Why? Because if we're already happy, definitely we don't want to suffer from bad scores again. Because it will only tell you that you may be having some problems in your cardiovascular system. When I undergo cardio pulse test 2012 December, my score was 2. Others are saying, Doc, that's good enough. No. As far as I'm concerned, no. It was 2 going 3. Remember, I'm the medical consultant of the company. So, I would like my score to be 1. So what I did was, of course, I went to diet, exercised religiously. I took 2 soft gels of corridors, 3 capsules of sweet and perseverance, 2 sachets of Vida. And after 2 months, people, I was really saddened by the result because it was already 1.